everyone, we're back with our Friday Lives and giving you some tips about a health condition. So today we're talking about something that's really common in patients. We see a lot of female patients, and thyroid health is something that we see a problem with most of our patients. So our approach to addressing any condition is to look at the overall body. So when we run patients' thyroid conditions, thyroid labs, even when they're not here for thyroid issues, that's something that we run for almost all patients. Because if you have fatigue, if you have a hard time losing weight, if you can't sleep, if you have anxiety, if you just don't feel well, you feel like you have low energy, your muscles ache, you have joint pain, all these things could be related to your thyroid. So if you have done all your labs, if you have done everything, and you still have fatigue and you still can't lose the weight, you still can't sleep, maybe you should be looking at your thyroid. And I wanted to just kind of get this across how we are looking at a thyroid condition, how Dr. Verma and I approach thyroid health. So when you come in, we do a complete panel. First thing is extremely important to ask your physician or ask your primary care to do a complete panel for thyroid, which includes your thyroid hormones, not just the TSH level. That gives us an overview and a complete picture of how your thyroid looks like. That's extremely important. So after we do a complete review of your thyroid labs, then we look at what's missing. What is an individualized problem that we're looking at? Everyone is different. You may not be converting to have enough thyroid hormone. You may have hypothyroid, which is a diagnosis that you've had. You may have Hashimoto's, which is autoimmune thyroid problems, where you have your immune system is attacking your thyroid, so you have high antibodies. So all these are thyroid-related issues, and then we look at how to help you with it. If you can't lose weight, then we optimize your thyroid levels and help you with that. If you have fatigue, we look at that and help you with that. There are a lot of natural approaches that we can take with thyroid that I really wanted to talk about after discussing a little bit about how hypothyroid looks like with all the symptoms that I talk about, and how people can have autoimmune thyroid problems. And if you have other autoimmune issues, thyroid could just be one of them added to your autoimmune issues, because the underlying cause is really your immune system that's attacking your thyroid. So natural, when we look at addressing your thyroid, we always start with nutrition. So we look at what you're eating, what are your triggers. Your immune system is getting triggered. Your thyroid is sluggish, say you're hypothyroid. What foods? I don't know if you've heard of goitrogens. Those are some foods that are probably very healthy for you. Those are some green vegetables, some other goitrogens that are very healthy for you. But if you have hypothyroidism, that's going to increase your thyroid being sluggish. That's going to make you worse. It's not the cause of the problem, but it's going to make you worse. So we look at your nutrition. We set an individualized plan for you. We make sure that we work with the inflammation that you're having, and you have the right nutrition plan. And there are a lot of supplements or herbs that have studies shown that are really, really helpful to support your thyroid. One of them is B12. So if you take B12, it increases your cellular energy response. It boosts your cellular energy response, and you have more energy. So it helps with your fatigue. Then another one that I really like that decreases patients' antibodies when they have autoimmune thyroid, which is Hashimoto's, is selenium. Selenium really works with decreasing your TPO antibodies, if you know what that is. If you have autoimmune thyroid problem, then you know what that is. And then there are other herbs, like ashwagandha is an herb that's really that's beneficial for hypothyroid patients. So those are just some that I mentioned. There's a lot more, like depending on what is your problem, and then what really we have to look at. We also look at the underlying causes. If your gut is okay, how's your gut healing? Just remember that everything goes through your gut, everything absorbs in your gut, metabolizes from your gut. If your gut is not where it needs to be, you're not going to have that optimal level of health. So that's another thing that we're looking at as an underlying cause. We're looking at your gut health. We're looking at your thyroid hormones. We're looking at all the other hormones, like your female hormones, your estrogen levels. How is that connected to your thyroid? So all these connections, you want somebody who can look at all of that and who can find the underlying cause for you. So if you have more questions about thyroid, how you approach it with nutrition, how you approach it with lifestyle changes, with natural supplements, with herbs, feel free to give us a call. We schedule quick consults for 10 minutes to answer a patient's question, or you can just write your question right underneath this video and I'll be happy to answer those for you. You have a great weekend, and I'll see you guys next week.